The healthcare dynamic is rapidly changing. Understanding the basic fundamentals related to the business of medicine empowers practitioners to advance their skills in and knowledge of the business aspects of medicine. SMA's Business of Medicine Simplified program explores the essentials of everything from reimbursement and compensation models, insurance and risk management, to practice employment and business finance. Tech Frustration and Burnout, Making Technology Work for You. Not only has technology changed experiences for patients and their families, but it has also had a significant impact on medical processes and the practices of healthcare professionals. Join us for Health Technology Insights, Tech Frustration and Burnout, Making Technology Work for You. Doctors Andy Mohan and Reza Sadeghian will provide you with simple, common sense ideas on how to make technology and new innovations in healthcare work for you.
What is a physician burnout? I mean, that's really our main topic here for today. And from a clinician standpoint, when we talk about the burnout, we usually talk about the combination of multiple factors such as emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment. And looking at our current healthcare flow and system, and looking at the physician's perspective on this, we see that almost in every specialty and subspecialty, and the most recent data shows that in every 3 to 4 physicians are suffering from one of those components that I alluded initially. There is an epidemic of physician burnout in the United States, which has a pervasive negative effect on all aspects of medical care, including the physician career satisfaction itself. And if you look at some of the data from Medscape and numerous global studies, it shows that there are increasing number of physician dissatisfaction and lower patient satisfaction on the quality of care. We have an increased physician suicide and physician alcohol and drug abuse and addiction. And also we see a lot of higher physician and staff turnover for the variety of causes of physician burnout. Some of this reason that I can allude to that is a combination of factors from work, from the environment they practice in, from the technology they use, from the time pressure standpoint, from the family responsibilities, and the last one, but not the least one, is their low control of pace of their workflow.
Reza, yeah, I totally agree with you. It's a pretty big epidemic going on through the U.S. I've been to a lot of different institutions, and I continuously see a lot of providers just struggling throughout the day, just trying to complete, just get through their patients throughout the day, trying to spend as much time with them, but they're focused a lot more on, the technology or other, other tasks that kind of take them away from their patients, like data entry, those type of things. So, they're typically, you see a lot of providers, especially on the ambulatory side, a lot of primary care providers that are, they're sitting there charting till 8, 9, 10 o'clock when they should be with their family. And of course, that resorts to a lower quality of life, which trickles down to a lot of other things. So not only are they affected, the patients are affected as well. So it's something that needs to change. It has to change at some point, because we're at a drastic point right now in terms of this situation. Not only that, a lot of these providers that are really suffering on the ambulatory side and on the inpatient side, they're influencing. I mean, they're obviously they are the mentors for a lot of future physicians and providers and nurse practitioners, PAs. I can see a lot of them dissuading going towards medicine, which is also going to cause a problem in terms of the supply demand of obviously we're going to have a lot more supply of the baby boomer patients, but we're also going to be losing a lot of those providers, and we're not going to train as much. So I just see a lot of, a lot of issues going on with this continued physician burnout, which we need to fix.
What do you see one of the most important factors over here?
I think it's multifactorial. I certainly do think that the EHR does play a part, but I think that there are systems that are robust enough and they have enough tools that you could, you certainly, personalize it and, build out certain templates, certain support tools that are going to help you throughout your day. I think one of the biggest issues is the fact that providers are being asked to, do a lot more data entry. They're given that task, which they should be more focused on their patients, which is it's kind of difficult for them because they want to focus more on their patients, but they're focused more on the technology. So I think one of the ways we could certainly help them out is if we get their team or their clinical support staff to help them out with that scenario. That data entry. If they can do a lot of that, it can actually pull a lot of the pressure off of these guys.
Yeah, I agree with you on that. I mean, looking at how our electronic medical records operate in the US versus the same system overseas, looking at how many regulations we have and how much work the physician needs to do in order to complete the task. It's interesting that one of the latest paper that came out was comparing the number of characters that the physician in the US had to put into their ambulatory care notes compared to the outside United States, which was almost 4 times longer, and the amount of work that the physician needs to complete in order to be in order to fulfill the task from the coding perspective, the billing perspective. It was quite amazing that how much more satisfaction you would get out of the same EMR in, for instance, Australia versus United States.
Right. I think that there's certainly something to be said about technology making things more efficient in other industries, and right now it seems to be kind of bogging things down in the healthcare industry. So these kind of things is we need to change it. It's obviously it's going to keep evolving into more of a user-friendly type of systems, but I guess those things kind of take time. And in the meantime, we have to have we probably need more support staff to assist these guys so they can do their job, and assist all of us so they can do their job and do well by their patients and what they're trained for.
Yeah, I agree with that. I mean, some of the things that I noticed that we tried to do in our practice was to, first of all, analyze the workflow after we implemented the medical record. So we tried to look and see how things were going on the paper, and now that we are replacing this system with our paperwork, what things we're going to change. And one of the analysis that I always tell my staff is, if you buy a new electronic device and you don't know how to use it, the first thing you do, you go and read the manual. Unfortunately, with electronic medical records, you can go to the help section, but that's going to be quite extensive. And most of the time, these practices or the institutions where they have the electronic medical record implemented, they don't really look into this workflow that they have and how they can modify it even before they go live, or if the physician have enough training based on that new medical record. And also moving forward with that electronic medical record, what are the tools that the system they give them that they can modify to their needs? What do you think on that?
Well, I think I'm going to take the second part of that, the training aspect of it. I think that's a very, very good point, because Yeah, they may have training, and all of these guys are getting the proper, they're getting training. However, they may be learning the wrong things, number one. They may not know what they don't know, so that's another thing. What are they, you have to have someone who's, I think you need, informaticists that are essentially understand all of the different tools, and then you can individualize the training sessions so that you can optimize their workflow. And of course, you want to remove the non-value added segments, those type of things. But when you're looking at the training, I've noticed some good and bad training. I've been to all these different institutions, and you'll see some good trainers, you'll see some mediocre trainings, and some pretty bad ones too. So you're going to see all of that. So how do you standardize the training? How do you ensure the integrity? I think it's all in the hiring process. You have to make sure that we're not just filling in a trainer just to have a trainer in there, because that's another thing that'll lead to a lot of frustration for providers, a lack of adoption of the system, and as in any of these type of things, it's the 80/20. I'm sorry, it's the 20/60/20 rule. You'll have 20 people, 20% that actually know the system that are tech savvy, 60% are going to be kind of on the fence, and then your 20% that are not going to be as tech savvy. And you want to make sure that those guys are up to speed, they get the tender loving care, and they understand how to use it to the best of their ability. So I've seen it all in these last 10 years roughly. So
Yeah, I mean, regarding training, that's an interesting things you brought up, because I'm not sure if people know about some of the features of the new EMR, but the EMR now allows the leaders of that team, the physician, informatician, to actually track physician EMR use and efficiency. So they compare the data from those efficiency report with targeted physician education to make sure that they can improve their education and reduce burnout, and continue to have the quality improvement and meaningful use of that EMR.
right, PEP data. So that they have been using that kind of data. So they are tracking providers and evaluating their efficiency using the EHR. And another thing that I wanted to add, because you brought up PEP data, a lot of institutions are actually they're looking into alert fatigue as well. So best practice advisories. So these little pop-ups that come up to give you clinical decision support, and that's another thing that's burning physicians out, because they have to click on these things. So which ones are actually utilized and useful versus what's not? And I'm not going to name the institution, but there was an institution that I worked at. They did a study on this, and out of 100% of their all of their BPAs, only 1% was actually being used. The other 99% were being overridden. So that's kind of an interesting little study there as well, and that kind of contributes to burnout as well, because you just have to keep clicking on this thing, and it causes a lot of fatigue for providers as well. So.
Yeah, I'm glad you mentioned about the unnecessary EMR alert. The other things I can think of is are there any tasks that other member of the care team should be doing so physician can work on things that is part of the physician's medical care,
I
rather
think
than entering all those data to their EMR system.
so. There's multiple things. I think there's multiple areas where, first of all, and first and foremost, in every institution I've seen, there's no standardization in terms of the staff. I think the staff can help them out. So the hiring process should have some sort of, guidelines onto job description on what they can do or what they need to do for the provider. So there has to be something there. So you can't pick and choose. No, I don't normally do this for my provider, or this is what I do. Everything should be standardized. So this is what we're going to provide you. So you don't have to do it. It's data entry. You're going to be taking care of your patients. You're not going to be doing this. That's one aspect. I think that pre-charting is extremely important. So pre-charting, teeing up orders, teeing up templates, maybe even completing the review of systems. Very, very important for it, because the review of systems, essentially, it's just a questionnaire for the patient. A lot of times it's not even utilized. It's not even looked at. So I think that could be taken care of, and it's many times it's just pretty much for billing. Um, I think those are two very, very important elements. Again, if, the provider needs to understand all the tools available to them, build robust templates, build out their preferences and the versions of different order sets or whatever it may be, templates for that. That's very important. But I do think that even a simple phone call, like before a patient's coming in for a scheduled visit, uh, to start scrubbing the chart would be kind of beneficial. So designating a person to do this, for that week, just to go and scrub the chart would be great. And everyone has a turn to do that. You call the patient, see if they're coming in first of all, and then scrub the chart. I think that would be pretty beneficial, because that would kind of narrow down the rooming time and save time for everyone.
Yeah, one of the other things that want to add to what you said is using the tools that their current EMR provides for them. And a lot of time they don't know it exists, such as voice recognition, or some practices and institution use scribes to kind of expedite their progress notes, or any type of notes that they use on a daily basis.
There's also getting a little bit more granular into technology. Some institutions are already, they're using like patient questionnaires, so they'll have a portal and they can fill out a lot of information on that. That can also be a very useful tool if they can fill out things. Obviously you're not going to have many of the older patients that are going to sign up for these type of things, but you never know. If they do sign up, they can fill out a lot of that information. So that also eliminates something too, eliminates a non-value add, or a portion of the workflow, which seamlessly can enter into the patient record. I think that that would be great. If it could even flow right into the note, that's great. I mean, there's institutions that are doing that. You're having these questionnaires, a kiosk essentially, in these ambulatory clinics, that you just have an iPad and they just go boom, 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 demographic information, review of systems, and what other information that you may have, some population health, visits, annual wellness visits. They have the HRA, the health risk assessment, which you can actually input that data. There's just a lot of things that you can actually do with something like that. So technology is going to make things more efficient, but it's right now, it's in its infancy, and we're just kind of working on things and trying to make sure that our providers survive this big healthcare tech boom.
Do you think one of the first step that perhaps those who are challenging with the physician burnout would be to kind of take a step back and look at their current workflow and kind of get an idea of how much their current workflow is actually optimized to their electronic medical record?
Yes, absolutely. I think that it's always good for someone to come in and kind of evaluate that situation and see what your current state is and what your future state could be, because it's not only the time, it's the quality of life, and then it's also money saved or money gained. It's kind of both. So I think that's definitely something that is very useful. And again, I mean, a lot of practices, you just don't know what you don't know. Getting the right people to help optimize those kind of things, it certainly does help. And I mean, it's always, I think 99% of the time when myself or other physician consultants that have the experience that have gone into these type of situations, it certainly has helped. We've never gone into something that it's like you guys were. It's always helped out the clinic or facility tremendously.
Want to learn more about these topics? Make plans to attend SMA's Southern Regional Assembly June 27th through 29th in Birmingham, Alabama. Visit sma.org/assembly for more information and to register.